my screen here. Okay, sharing my screen. Can you see this?
Yes.
Perfect. Okay, just get my screen set up right. And away we go. So, hello everybody, and welcome to our info night on lupus. I hope you've all been doing well. I know it's a bit of a grind at this point in the semester, so please try to prioritize your mental health if at all possible. The Student Wellness Center does have great support for mental health, as well as the Distress Center, which has a 24/7 crisis line. So the first type of lupus I want to discuss is systemic lupus erythematosus, often shortened to SLE. Lupus is an autoimmune condition, meaning that the immune system gets ramped up for no discernible reason and begins attacking the body's tissues. This can cause a whole lot of problems, and the name systemic lupus indicates that the immune system could be targeting the body anywhere. The group of people most commonly diagnosed with lupus is people assigned female at birth anywhere between ages of 15 and 44, though it can manifest as early as the onset of puberty. The symptoms of SLE include fatigue, rashes, fever, arthritis, sun sensitivity, oral ulcers, pleurisy, which is the inflammation of the lining surrounding the lungs, and pericarditis, which is inflammation of the lining around the heart, as well as kidney problems, seizures, psychosis, general abnormalities in the blood cells, compromised immune functioning, headaches, chest pain, and hair loss, as well as something called Raynaud's phenomenon. Raynaud's causes decreased blood flow to the extremities in response to spasming of the blood vessels, making the extremities appear stark white in Caucasian skin and grayish blue in darker skin. It can also appear quite vividly blue in Caucasian skin. Diagnosing lupus can be quite complicated. So the first on the checklist is often an assessment of symptoms, though everybody with lupus experiences things very differently. Blood tests are also very common as a diagnostic measure, looking at low white blood cell counts or low platelet counts, as well as a measure called erythrocyte sedimentation. This measures how fast the red blood cells drift to the bottom of the container, and it's often much faster in people with lupus than it is on average. Tests also look at positive anti-nuclear antibodies, anti-double-strand DNA, anti-Smith, and antiphospholipid antibodies, which indicate an autoimmune infection. Chest x-rays are also often done to check for pleurisy or pericarditis, and urinalyses are conducted to look for proteins and such in the urine, which could indicate kidney damage. Lupus treatment is very medication focused. Immunosuppressive drugs can be used to sort of calm down the immune response and lessen some of the symptoms, though they can often impair the body's ability to respond to harmful pathogens, along with lessening the autoimmune response. Some of the common immunosuppressive drugs used to treat lupus include, let's see how I do at pronouncing these, azathioprine, mycophenolate, Mofetil, and methotrexate. Anti-malarial drugs have been shown to have a significantly positive impact in people with lupus. Hydroxychloroquine is the most popular of these. This is a disease-modifying anti-rheumatic drug, or DMRARD, and can help reduce the number of flare-ups as well as reduce the skin sensitivity to UV radiation. Hydroxychloroquine had a moment of popularity in the news a little while ago when an unfounded rumor circulated that hydroxychloroquine could help treat COVID, and there was a bit of a shortage. Multiple very, very reliable sources have stated that there is no benefit to taking hydroxychloroquine for COVID, but this shortage caused harm to a lot of people with lupus. You can find more information on this at lupus.org if you're interested. And then corticosteroids such as prednisone can be taken to reduce inflammation, as well as biologics such as belimumab. I'm really not sure how to pronounce that, but we're just going to roll with that. And those use the body's own defenses to try and lessen the autoimmune response. Then finally, nonsteroidal anti-inflammatory drugs, or NSAIDs, can also be used to alleviate pain. So there are a lot of complications that can occur with SLE. One of the most commonly seen is renal inflammation. That is inflammation in the kidneys. Renal inflammation can be seen in high blood pressure, swelling in the feet and hands, puffy eyes, and changes in urination. Some neurological symptoms are common, such as seizures, strokes, visual disturbances, and psychosis, along with depression and anxiety. People with lupus are at a slightly higher risk of cancer than others. Infection is also a higher risk in people with lupus due to their compromised immune functioning, so it's extremely important that they try to do their best to reduce their exposure to infection as much as possible. Bone tissue death can also occur, and anybody with lupus who is pregnant is considered to be quite high risk. There are a few other types of lupus I'd like to go over. The most complex and most common form is systemic lupus erythematosus, so I wanted to make sure I touched on it first. So the next type of lupus I wanted to discuss is discoid lupus erythematosus, or DLE. DLE typically only affects the skin, though around 10% of people with DLE go on to develop systemic lupus. The type of rash that's indicative of lupus, DLE or otherwise, is known as the butterfly rash, because it's spread across the nose and cheekbones, rather like the shape of a butterfly with its wings outstretched. I found this illustration of a butterfly rash from the Mayo Clinic website. The other type of common rash that will form is called a discoid rash, which has raised, round, or oval patches. And please remember that rashes look different on different colors of skin, and that not all doctors are educated in how to assess rashes on darker skin. So some people with darker skin may not be taken seriously by medical professionals. Just because lupus is diagnosed more often in people of color than it is white people doesn't mean that those people don't experience medical racism. That's still very much a factor at play here. Another form of lupus is drug-induced lupus, which is an autoimmune inflammatory response to certain prescription medications. The symptoms stop when the medication is stopped, but it's still extremely uncomfortable and can do damage to the person's organs. Some of the medications that are known to have higher than average rates of drug-induced lupus as a side effect are hydralazine, procainamide, and isoniazid. Yeah, I didn't pronounce that right, but we're going to roll with that again. Medication names are very complicated. Please don't avoid these medications just for this reason. Drug-induced lupus is pretty rare, and if it's a concern of yours, then please talk to your doctor about the risks, as you should with any prescription medication. The last type of lupus that I want to discuss is neonatal lupus, which technically isn't true. Oops, I left the slide in on accident. There it is. Here's the right slide. It technically isn't true lupus because it's not autoimmune. This appears in the infants of people who have lupus as part of the imperfect filtration system that is the placenta. The placental barrier won't block everything, which is partially how blood types work and is partially how it's possible for babies to be born with HIV. The main risk with neonatal lupus is congenital heart block, which interrupts the system that regulates the heartbeat and can cause serious issues. Congenital heart block is also called atrioventricular block, or AV block, and if you know anything about the conduction in the heart, then you know how critical they are to keep the heart beating. The sinoatrial node acts as a natural pacemaker to regulate heart rate, and the signal travels down to the atrioventricular node. The AV node then makes sure that the heartbeat actually travels from the atria to the ventricles, which is very important for the proper flow of blood through the body. In an AV block, either the ventricular contraction lags behind the atrial contraction, or there's an extremely low heart rate and missed beats. Either way, it's a substantial problem. The other symptoms last up to 6 months, so even if the baby doesn't have congenital heart block, it can still be extremely uncomfortable. So with heart block, you can see here, I don't know if you can see my mouse, but at the top here where it says right atrium, so the blood comes in there, and then the atrium squishes the blood through the tricuspid valve into the right ventricle. And the blood from there should get squished up through the pulmonary valve. And the ventricles are substantially bigger than the atria, so they are responsible for a fair bit of the conduction of blood through the body. So it's very important that they beat on time. So I've got a video lined up for you here. I'm going to show you the first 6 minutes. The speaker is an immunologist who spent a lot of time studying lupus, and she centers the experience of patients whenever possible, which I appreciate. Please let me know if my sound doesn't work. I think I figured it out this time. Pretty sure I did it right, but let's roll the clip.
Almost 2,000 years ago, a writer in ancient Rome asked a question for which we still need an answer. The writer was Juvenal, and the question was, who will guard the guards? He was asking how the emperor could trust his guards. This question has application to health and medicine also. What protects the body from its armies? And one of the most powerful armies we have is the immune system. When the immune system functions well, it deploys a variety of mechanisms to protect against deadly threats, such as invading microbes and cellular debris. But what happens when the immune system goes rogue and the guards attack the body they're meant to defend? This is the essence of autoimmune disease, and it happens more frequently than many recognize. Approximately 10% of the population suffers from some form of autoimmune disorder. So to paraphrase Juvenal, how can we ensure that the immune system protects and doesn't harm us? As always, when solving a problem, one needs to understand its cause. So we need to ask how and when the immune system goes off track. So let's begin with the healthy immune system. The healthy immune system functions as a green sanitation system and removes cellular debris in a non-inflammatory fashion. The healthy immune system also targets and eradicates microbes such as bacteria and viruses without targeting those microbial structures that are also present in host tissue. But sometimes the sanitation system and the smart targeting system fails. When that happens, the immune system mounts an inflammatory response in a healthy host and damages healthy host tissue. Lupus is a dramatic example of this. Lupus is an autoimmune disease that affects women 9 times more often than men. It also affects African Americans, Hispanics, and Asians more often than individuals of Northern European ancestry. Lupus has genetic causes and environmental triggers. Interestingly, some of the genes that predispose to lupus protect against severe malaria infection. I became interested in lupus when I was a medical student. I went to medical school during the era of the Vietnam War. Pogo, a popular cartoon character of the day, famously said, "We have met the enemy and he is us." How ironic that what was true of our national politic is also true of autoimmunity. There was also a wave of feminism sweeping the country at the time, and I was fascinated by Southern women authors like Eudora Welty and Flannery O'Connor and Carson McCullers. Autoimmunity touched even these literary circles. Both Flannery O'Connor and Carson McCullers had an autoimmune disease, and notably, Carson McCullers had lupus. I became a physician scientist because I was too impatient to wait for others to take us through an impasse in our understanding of disease mechanisms or how best to treat disease. In some small way, I had to contribute to new knowledge, and the disease I chose to study was, of course, lupus. Lupus is characterized by autoantibodies that target and damage skin and kidney and heart and blood vessels and more. But lupus patients also complain of problems with memory and executive function. Patients call this a lupus fog, and they can experience excessive anxiety or depression. These symptoms were long ignored. My laboratory and our collaborators decided to take these symptoms seriously, and that was a critical first step. Because we listened to our patients, we asked whether the antibodies that cause problems in other tissues in the body might also be affecting cognition in patients and causing emotional volatility. And we discovered that indeed they were. In fact, one lupus patient told us that she could no longer recognize the block she lived on from a block away. And we were able to show that lupus autoantibodies can cause a selective impairment in map making. These antibodies don't always cause problems, and that's because
So that's all I want to show you of this video. There's about 5 minutes left in it. You can use the QR code or the link here to look at it further if you'd like. I appreciate that she mentions what's called the lupus fog. You may have heard in the news recently, people are talking about the COVID fog that happens with long COVID, or people with fibromyalgia experience something that they call a fibro fog. Brain fog is also really common in depression. I think it's a really interesting neurological symptom. It sounds like it'd be very hard to deal with, and I'm glad that it's getting the attention it deserves because it really does impair functioning. So the charity we're going to be supporting this time is Lupus Canada, and it's one of the largest organizations for lupus in the country. Donations to this organization go towards advocacy, research, and scholarships. I really like that this is a federally recognized nonprofit, so I would hope they wield a little bit more power. You can donate on their website using the QR code here or through the PayPal link on our website. This is going to be uploaded though, so please don't worry if you're not getting a QR code right away here. There is time. There are a handful of awareness days coming up in the next little while. World AIDS Day is on December 1st. Women's Brain Health Day is on December 2nd. The United Nations International Day of Disabled Persons is December 3rd, and Human Rights Day is December 10th. So please stay tuned for our next event. If you're in the neighborhood, I'm doing a talk about the internalized stigma surrounding mental health and wellness on the Foothills campus on December 6th in room G500 in the HSC building at 1 p.m. Please feel free to come. That's also going to be on Zoom too. It's I believe it's with the Foothills Graduate Wellness Council. So if you look them up, you should be able to find more information there. Other than that, you can follow the QR code to get on our mailing list if you're not already. Good luck on all your exams and papers, where you don't have another info night planned for the month of December since it is final season and we are all very tired. So thank you so much for coming. Does anybody have any questions for me?
I actually have a question. Great presentation, by the way.
Thanks, what you got?
Did they know the reasoning for the butterfly rash? That's very, I was just wondering why it's so specific to
I
that
didn't
area.
find anything on that. Yeah, I'm not 100% sure because it is a very like
It's very
specific
distinctive.
hallmark. Yeah, it's kind of like the bullseye rash that comes with Lyme disease. Well, in 10% of Lyme disease cases,
Right.
but it is very distinctive. I'm not really sure, but
Yeah.
it is pretty cool.
Hmm.
Anybody else have any more questions for me?
No questions, but yeah, that was really good presentation. Thanks, Kaylee.
Thanks. Yes, well, if nobody has any more questions, always feel free to email us. Feel free to reach out on Instagram, check out our website, and thanks everyone for coming.
Thanks so much.
Thanks.